Chuck Fresh along with Dr. Mary Devereaux. Thanks for coming back. I didn't think you'd come back on the show after that.
Yeah, one more time.
One more time.
Right,
good.
it.
So we're going to talk about the differences and the joining of Eastern and Western medicine, which is your specialty, right?
That's right.
You're integrative or integrated?
I guess it's how you use that end tense.
What does that mean? Let's start there. Integrated. Integrative.
Integrated. Integrated medicine.
That's you're a doctor of integrative medicine?
That's right. That's right. So you bring Western medicine and Eastern medicine together.
And integrate them?
Integrate them.
I like where you're going.
Yeah.
Let's talk about the differences of Western and Eastern medicine. So Western medicine refers to a system in which medical doctors and other healthcare professionals pretty much poison, burn, or cut. I'm sorry. That means drugs, radiation, or surgery. That's pretty much how Western medicine works, right?
Oh boy.
Maybe oversimplified.
Oh boy.
Okay? I'm a little
frustrated about Western.
Frustrated, sarcastic today, so bear with me here. That's why Dr. Mary may never come back on the show, and I don't blame her. This is sometimes referred to as allopathic medicine or conventional medicine. All right, so the history of Western medicine goes back several thousand years to the ancient Greeks. Hippocrates is often credited with being the father of Western medicine because of his scientific descriptions of many diseases and their treatments.
Yeah.
Hippocrates also had this creed: do no harm, let food be thy medicine.
That's right. It's an oath we still take.
And I feel like we've kind of strayed away from that.
Let food be thy medicine.
And do no harm.
And do no harm, yeah.
It's some of the things we're doing in medicine. So I call it's my term, I call it the Hippocrates hypocrisy. Do you see what I did there? And we'll talk more about that later, why I feel that way. But that is not Dr. Mary Devereaux's opinion. That is my opinion. So let's get that understood. So Eastern medicine, also known as Asian medicine, Oriental medicine, or traditional Chinese medicine. What does your degree say?
My master's degree is Oriental medicine.
Oriental?
Yeah, that's on the diploma.
Okay.
But
so it's not a bad thing. It's actually
it's not
used.
But they are kind of straying away from it because it just has a negative connotation a little bit.
Understood.
And they just don't, use it as much.
So it's the oldest codified system of medicine in the world, going back 4,000 or 5,000 years.
Yeah.
It's incredible. It goes back that far.
A long time.
Refers to a range of medical practices that originated throughout Asia. Now, Eastern medicine uses complex patterns of disharmony or imbalance within your body. This is hard for me to understand, to determine a diagnosis. So the basic philosophy is to treat the whole person, encouraging a healthy body to prevent illness and speed recovery.
Right. Well, the body works as a system. You can't really pull apart different organs and work on them only without understanding that your digestion starts in your mouth and then ends through the intestines. You have your esophagus, your stomach, you have your liver working, your kidneys working, all working in this digestion. So you can't just say, oh, this isn't working, and let's just work on that. It all works together.
I feel that Western medicine tries to separate everything. That's how I feel.
Mm-hmm.
All right. So there are 5 major branches of Eastern medicine. We have acupuncture, Chinese herbal medicine. They call it Oriental nutrition and dietary therapy, Tuina, or Oriental body work, and also Tai Chi and Qigong, which is mind, body, spirit practice.
Right.
Fortunately, and I think this is great news, many prestigious medical centers are starting to integrate Eastern medicine along with Western medicine and kind of pull them together, doing integrated medicine, which I think is great. Because we really need to look at the whole body holistically.
Right.
I feel we haven't been doing
it. Wasn't working the other way without adding all the modalities for your whole body.
I completely agree. So Eastern medicine has been found to be beneficial in treating conditions in combination with Western medicine. Now, you studied both.
Right.
The integrated education you've had allows you to explore both.
Right.
Okay, so a lot of physicians don't have that, right?
We do a lot of biomedicine on one side and blood work and MRIs, imaging to see what's going on. And then you can add the Eastern approaches, which would be the acupuncture, which acupuncture is so great for lower back pain because you have these muscles that bind up, we overuse them and then just get tight and stiff. It pulls on your spine because you're trying to balance, and then you have these knots and they cause a lot of pain. They're called like trigger points. If you've heard of trigger points, they're really painful. So a needle, acupuncture, so thin needle, it just slides into this muscle that's all bound up. It unravels it, gets some oxygen in there, and you get release. And that's where people walk out. They're walking in on crutches and things, and they just have all this pain. And then they go, I can't believe it. They do come back a lot of times and say, oh, it came back.
Yeah.
But what happens is they have bad habits. So they're leaning the same way, they're doing the same activity that they were doing before to protect their back, and then that muscle binds up. So it's it takes more than one time because they have to learn new strategies to not, keep that, back from getting hurt.
I think that's great. I think there's a lot of maybe the older physicians didn't have the Eastern methods. They didn't learn those. Do you think? Is this normal that most new physicians learn both, Eastern and Western?
Oh, I'm not sure. I think that it comes to the individual doctor, and you have to be choosy on who you pick. You have to have one that looks at you like they would themselves, how they want to feel, fully, better.
So are Western physicians beginning to integrate Eastern medicine into their regimens? From what you've seen so far?
What I've seen is definitely acupuncture. They know it helps with pain. And so they'll definitely have people going there for pain, but I don't know if they understand more of the food therapy of it and the value of what food does more than they have to do the medication, the drugs, put a script out for that.
Understood.
So,
is there a formal degree or board certification process for Eastern medicine in the Western world?
Yes, so an acupuncture physician, they take 4 boards. They go to school probably about 4 years. It's a graduate degree, and they take clinical hours, like over 200 clinical hours working in the clinic, doing that. A lot of times with Asian people who have learned over the years. So it's
a similar residency as you see.
Yeah,
in Western
it's
medicine?
intense. It's intense, and the boards are tough. So it's good stuff. So you can trust that they know what they're doing, but it doesn't mean that they're going to look out for your best interest too. You also have to look at that Eastern physician and say, is that the right things for me? Because I'm very science forward, and I'm very Western Eastern together, but some are more Eastern, and
how do the diagnostic procedures differ between Western and Eastern? If I go to a Western doctor, they're going to look at me one way, and Eastern doctor is going to look at me another way. How do they differ? Like, what am I looking
Well, like if you go to a physician, a Western physician, and you say, I have a headache, and they're going to say, okay, let's give you some medication to stop the pain. But if you go to an Eastern physician, they're going to figure out where the headache's coming from and why it's coming. So where it's located on your head, and where you maybe you were sweating all day and you have a headache from you're dehydrated, or maybe you have muscle pain in the back of your neck, and that's causing the pain. It can cause pain in your eyes too, like right here, and that's from pain up here. And so that's how it kind of differs, is that we're going to hear a little bit more and what's going on, and then try to give you the right thing to fix it.
So, to me, that makes so much more sense logically. Let's find out where the problem's originating and attack that first, rather than just treat the symptoms. That's what I feel like Western medicine does.
It can, but you also can have a good physician on the Western side that recognizes the reasons and help you with that. But if you just come in and say, I have this headache, just fix me, they're going to just maybe give you a med and be off with you. But if you make a list of when your headaches are coming, do you get them in the night? Do you get them in the middle of the day? Is there something you're eating that's triggering? You have to be your own detective for yourself, and then go in with your list of things that are going on. Even if you don't know if they resonate because of your headache, you need to bring all that in. So they don't have that much time. So it's like, okay, here's what's going on with you. Okay. Then you want to go to a physician, a Western physician or Eastern, that's going to be able to look at that and help you.
So you're saying regardless that most patients have the responsibility to know what's going on with themselves and really keep track of things.
You do. You have to. It's your one body, one life. You have to look out for yourself.
Now, what about, and I've run into this situation with my own personal cardiologist. I looked up a bunch of symptoms that I was having on the internet. I approached my cardiologist with this, and he's like, another one of those, what are you, an internet doctor now? And I thought that was really offensive.
Yeah.
And I walked out of the office, to be honest with you. I found a different cardiologist. But I feel like a lot of doctors don't want you to look into. I think it's the responsible thing to do, wouldn't you think?
I do. I
At
definitely
least know what you're talking about.
One thing good about it is when someone comes to me and they've looked online for stuff, I am proud of them that they want to heal.
Right.
Because if they're just coming in and it's like, do whatever you want to, then I'm just like, I don't value that they really want to put the effort in. But also, it's really hard to search things online and get real answers, because everything has like the same symptoms, or you're dying of cancer or something. It's really difficult to look up. And if anything, when they come to see me, I'm going to help them search better. Like there's a better way to search.
That's
for the right.
Interesting, because you came out with a video that shows people how to search online for different things, how to filter through all the advertisements for all these snake oil treatments.
That's right. We looked up cancer. Why do we get cancer? And like the first pages were, it's hereditary, nothing you can do about it. And then we added some different like key questions in there, and we found out 80 to 95% of cancers come from toxicity, from like our waters, pollutants in the air. 80 to 95%.
Yeah.
Like that's huge. Yeah. So why aren't we working on that? So that's the video.
Completely agree. I don't want to send you off on that. You mentioned before the interview there are 8 principles. It's something called an 8 principles diagnosis. Can you tell us a little bit about that?
Absolutely. Right, on the Eastern side, which is very basic. I think we do this with our animals all the time. It's, are you running hot or cold? Are you running excess or deficient? Like, is your dog acting up, or is it really calm? Is it nose dry or heat? Or, you look at their bowel movement. We learn from we do all those principles with our animals, but with ourselves, we don't even value that.
We don't.
Yeah, so it's just basic things. Are we running hot? And there's so many signs that say that our body's temperature is not the right temperature. So then there's foods that cool you down or heat you up, like ginger. Ginger's always warm. Whether it's in a cold drink or a hot drink, it's always warm to the body. And mint is always cold. So it's like that, but every food has a character, a nature that will, build you up, or, if you were too excess, bring you back down.
So you mentioned ginger. So does a lot of the Eastern philosophy deal with treating with herbs?
Oh, absolutely. It's huge. Acupuncture works great, but you have to have the right nutrients. You have to have food that's right for you. It doesn't mean you can't have fun foods. And I always teach my son, that's fun food. As long as you recognize you're eating for fun, then you can get your nutrients in. But it's huge. Obviously, you need it to survive, the right foods for you.
Right. That's really interesting. We've kind of gone away from it. We call it quackery. We talk about these herbalists who prescribe herbs to take care of different medical situations is silly. But
Right.
I don't believe that's true.
On the one hand, you hear this quackery that it's non-science, and then the same, people will say, if you have too much of this, it's toxic because it is a drug.
Right.
So you get this, it doesn't, it's a fight constantly, because obviously food can be a drug. You have too much of anything, it's a drug. But herbs are little powerhouses of nutrients. So it can definitely be too much in your body if you do too much of something.
So you run this concierge service where you can treat pretty much anybody anywhere in the world, right?
Right.
So do you prescribe herbs? Are you allowed to, or were you educated in herbs?
Right. Yeah, I took a board in, I'm an herbalist, so it was a lot of work to learn about the different qualities and properties of herbs and foods. So I usually try to figure out what the patient likes. I'm not going to give them an herb that they're not going to take, or I'm not going to give them a food and say, you have to have this if they hate it. So it's what's in their pantry now? What can we use that you need more of or less of? And honestly, there are some things to get rid of, probably. But if you crave sugar, there's a reason why you crave sugar. So you should have sugar, but let's do the right sugars. If you crave salt, there's a reason. And salt's the most important thing we need, besides maybe breathing and maybe some water. But salt, sea salt, we talked about that.
We have a different episode on this channel, so make sure you watch that. About salt, sugar, chocolate, what were the other things?
Wine,
red wine, that's right. So a lot of
Good
things,
stuff.
a lot of people have classified. I just saw an article today in the news that CNN says that people who add table salt have a higher possibility of dying younger, but I don't think that's necessarily
table
true.
salt is white salt.
Yeah.
They would have to say sea salt, because sea salt has 80 minerals in it. A white salt has nothing. It's just been stripped of all of it.
Right.
It's been purified.
Yeah.
I hate that.
So you would call sea salt like a vitamin, right?
Yeah,
Or a
I
supplement,
absolutely feel it's a vitamin, and I have people take it even though they're scared to, because they've always been told don't have salt.
Yeah.
But every cell needs salt. Your kidney needs salt. They need sea salt, which has the magnesium, the potassium, the calcium, all these things to make your muscles contract and relax, and your heart, work properly. But if we are doing a lot of processed food and a lot of white salt, we're going to have an excitatory that's going to harm us. So you can't do the white salts, but you absolutely 100% need sea salt.
Interesting.
Yeah.
Are there board certified or peer reviewed studies of the efficacy of Eastern medicine?
There's a lot of case studies on acupuncture, because that's an easier one to do, but you got to the funding to do a case study is a lot. And we don't, Eastern modalities don't make a lot of money. They're not going to sell a big
They're not gonna
herbal
get you on
company going to
a
sell.
lifetime prescription of something.
Yeah, so you're going to have a lot more case studies with the pharmaceuticals that are going to bring in like more money for
It's
them.
just so sad when you think about that. It's not really set up to find the cause and alleviate the cause of whatever ailment you have. It's just, let's just keep it going on forever.
Yeah, I feel like the path has gone like too far that way. Because obviously we need pharmaceutical drugs. We need surgeries. We can't be without Western or Eastern.
If
but
you break your arm, pin's not going to help that.
Yeah, needles, acupuncture. I mean, it'll bring blood flow, but it's not going to bring the bones back together. Yeah, exactly. But I feel like we've gone too far in the pharmaceutical where maybe they can find a way to reel it in with some natural. Even I would buy their natural herbal pharmaceutical things. But
do you use Eastern medicine methods in your own personal life, with yourself, with your family?
Right, that's all they use. Yeah. It's principles. Like I do acupuncture when I play too much tennis. My knees
On
get.
yourself?
Yeah.
Yeah.
Yeah. I honestly do forget about my needles sometimes, and I find one once in a while. And I'm like, oh, I got to take that one out. I know.
It's still in your leg.
Well, no, I had one like right here, and then I had one like up here, and I was going to bed, and I'm just like, oh, what's that? And then, so that's probably bad. I should probably not admit that. I wouldn't have.
Well, that's a good point, because apparently it doesn't hurt. Because a lot of people are afraid of acupuncture. They think about the needles. We do have an episode talking about acupuncture. We actually do a demonstration on Felicia. Yeah. And Felicia didn't tolerate it bad at all. She seems to have no problem.
Let's be clear, though. I don't leave them in other people. Just myself. Just myself. I kind of leave them on, walk around, do things, and make fall asleep.
Let's talk about the needles. Because people are afraid of needles. If somebody takes blood, it's a huge needle.
Yeah.
If you get an immunization, it's a big needle, too.
Right.
What are the needles in acupuncture like?
That's right. And if you do like needles, I have a problem with you. Because that's a little bit weird. Right? Yeah, if you're like kind of, want to do that.
I don't
so
like needles.
The needles are like the size of a hair. They're so thin and they just slide in. And a lot of times they're in a little barrel. So when you tap them in, they go through the pain sensors so people don't even feel them. And when I have people for the first time having it done, they're so like jumpy and scared. I go, let me just say, maybe I feel like you might even fall asleep. You'll be so relaxed. I'm like, no way. I come back, they're like drooling. You can tell they're drooling. I know they're drooling, and they've been sleeping and so that. And they just, it's. First time I did it, I was like shocked. I was like looking around, going, oh my gosh, and no one spoke English. Then they leave me in a room in the dark, and I'm like, how do I escape if there was a fire? Like, it's real concerns we have because we're not grown up with this modality. So I was just glad that I did it as my last resort. And then I'm like, this is crazy. And I learned more and obviously so passionate about it.
So I've had it in my face. Felicia's had it in her arms and her feet. And I can attest you barely feel anything going on. It is really relaxing.
I think if you feel it, you're a little dehydrated a lot of times, or you're tense because you're worried about it. Because your muscle's just a little bit tense.
I had it in my face. I saw him coming at me. And I guess the first one I was like... But after that, it was no problem whatsoever. So I can definitely vouch that there was no pain to it whatsoever. Yeah. And I was very relaxed through the entire procedure.
Yeah, good.
So the theory behind acupuncture, because that's probably the most popular Eastern medicine. What is the theory? I've seen pictures of these bodies with something called a meridian, like a map to the body. So if you stick something here in your finger, then your ear's going to feel better. How does that work?
So you remember how old this is. It's been 3,000, 4,000 since they could write it out. So they think it goes back further, but since they were writing about it, it's like 3,000 years old, the medicine and the modality. They used horns, like animal horns, and they would thin them down. Can you imagine putting that in your areas? Now we have these nice thin needles. So the meridians really run along the peripheral nervous system. So you have your central nervous system down your spine, and then you have peripheral. Because, we're very electrical. And if you touch here, I feel it. My brain felt it. So if I put a needle here, it's got to go from here to, how does it get there?
It's gonna come back.
So it's running a path. Yeah. And so they didn't cut open cadavers and look inside. They just poked and felt, and they found these pathways that run along the peripheral nervous system. It's amazing. They didn't have PS5s and, things like that and TV. So they really sat around and talked to each other and tried to really help each other and heal each other. So I just, I definitely find that that's how that works. And I can put a needle in someone in their back. They're like, oh, I felt that all the way in my toes. I'm like, I got the right spot.
That's pretty
awesome.
Cool.
Yeah, it's nice.
It's almost magic. It's almost mystical.
Oh, don't call it that. Yeah. It's very science. You hit
What do you do when somebody comes in and says, all right, this Western medicine's really all I know, and this Eastern stuff's a bunch of hooey. What do you tell somebody when they approach you with that?
Would they come in with a hooey? The word hooey?
The
I
hooey.
haven't heard that word in a while.
Hooey. Nonsense, mystical, magical. What do you tell them?
Well, you have to meet someone where they are. And so I'll have them ask me questions. If they want to know more science, I can give them a lot of science, or sometimes they want to hear the more Eastern philosophy, and I can do both. I can give them whatever they want to hear. But then I'll tell them about how the muscles relax when you slide the needle in, because it just needs some oxygen, how it gets tight. And usually they understand that. They're ready for something different. And I feel like a lot of them are already so broken, and they've gone through such a rigmarole of unsatisfying events, and they might not even trust what I'm going to do, but at the end they've trusted me, and then they go,
they've converted.
Yeah, they just.
Do you see a lot of that?
Yeah, mostly. It's a high percent. It's a high percent.
Where we live here, Central Florida, a lot of older people, a lot of engineers, and engineers by nature are black and white. They don't see the gray in between. It's either yes or no, on, off. It's like binary.
Yeah.
But I can imagine you see a lot of people like that here.
I have mostly, athletes are great because they want to get back out playing. So they're like ready to do it, and they actually have great results. Yeah. And then I do a lot of elderly that have lower back pain for like 20 years. So they come in, at a level of 9 or 10, and they have like their walker with them, and they're like in so much pain they can't even stand up straight. And then the first time they're walking up better, but a few times they're like, oh, I have like maybe one spot here. And then they don't come back. It's like, no, keep coming back, because you're still leaning this way. You're still walking with your feet outwards. That's tightening your IT band. So you've got to retrain yourself too. So when people say, oh, I tried acupuncture once, that is the most frustrating, unsuccessful thing for their life, for me. Like that bothers me for them, because they didn't understand what it takes to do it. You don't try carrots once, maybe you do, but you have to keep doing it, and you have to know the reason why. So maybe they weren't educated why it's important, how it's going to help them.
Understood. Mm-hmm. A lot of people mention that Eastern diagnostics and treatments aren't covered by insurance. Is that true or untrue?
No, I take probably 5 or 6 insurances. Really? So especially for pain is a big one. Not as much. I mean, you could build office bills for consultation, where you can do a dietary consultation. Mm-hmm. And it's not the same don't eat this, don't eat candy, just eat salads. And salads are probably not really successful for most people with stomach problems. Eating a cold raw salad when your stomach's 110 degrees and acidic is not the best thing for it. It just wears it down more and more. So there's something you have to do to rebuild it, and then have salads once in a while. But in Chinese medicine, it's more soups and stews, because it's already broke down the nutrition's in the liquid, and it goes in easy, goes out to the body easier than having to break it down and wear it down. So. Insurances, yes. 5 or 6 with pain, it's really big. Insurances are covering. If they're over 65, have lower back pain, they get 12 visits in Florida, 12 visits, and then 8 more if they're getting some improvement, which is huge.
Yeah, that's awesome.
Yeah,
it's great news. They're starting to become accepted in the mainstream once the insurances begin to cover. Mm-hmm. Now, the last question I have for you. There's malpractice. There's things that go wrong. What could potentially go wrong with? I don't see a lot of things going wrong, but what could potentially go wrong with Eastern medicine? I
mean, our insurance is so low. Our insurance is $500 a year or something, paying for.
You're not really invasive.
And you've trained for so long. In certain areas, the needle just goes kind of shallow, or it can go deep, depending on where in the body. Mm-hmm. So it's so irresponsible. I haven't heard of any stories of too much. I mean, you get some bruising because sometimes you have superficial veins, and when you needle, or they move when they're laying there, or they jolt, when they fall asleep, and you have that jump. Yeah. Oh, that's such a good, I love that jump sleep thing. And so then they'll have maybe a little bruise or something like that. In cupping, people think, you want to talk about cupping?
Sure.
I love cupping because they've done it in so many different ways.
Well, tell me what cupping is.
Oh yeah, cupping. So cupping lifts up the fascia of the skin, and then lets blood flow get in there. So it's really good when you have muscle knots too. To me, I kind of call it a reverse massage, but it's a little bit different. You can do different modalities of it. But you put the cup on, and they did fire cupping. So you'd put a flame in the glass cup, And then it does,
like a magic trick.
yeah, it takes the oxygen out of it, and then you put it on the skin, and then the skin comes up into the cup. So it lifts up the fascia, and then you get blood flow coming through there, and you can either move it around, which feels really good. And people really ask for that a lot of times, like, oh, can you just do the cupping again? I'm like, no. And you can move it around, or you can just sit there. And if it gets discolored, like the swimmers in the Olympics that one time, they had all these colors. It's all the bruises, but it wasn't a bruise. It was old blood that wasn't moving in the body that was sitting there, and that causes pain. So it came up to the surface and then dissipated out through the body in toxins. So that's huge. Like if you have those purple, bruises, like, sorry, I didn't mean to keep calling them bruises, like the blood that's purple and old and stagnant, and getting it up. Yeah, it's kind of cool looking. I think they should make cupping tattoos like that. I think
they should, but they wouldn't last
tribal.
because the blood just kind of goes back in the system.
It goes out. The body releases as waste. Yeah.
There's so many really cool things about Eastern medicine. I guess we're it's been around 5,000 years, so we know kind of the basics of it. Is there more to be discovered in Eastern medicine? Things that we haven't really touched on over here in the States?
There's tons, right? And they're learning new places to put needles and new ways to do herbs and what now you can test how different herbals, if it does affect your kidneys. I mean, anything you do too much of something is going to put strain on like your liver or your, any pharmaceutical drugs as we know will have side effects. And it works on your livers and things. So there's definitely things also to cleanse your liver and kidney and strengthen them. But you wouldn't want to stay on an herbal medicine for long term. But we're, now that we can do case studies more and get into that more scientifically, I think that is pretty exciting to put it. I want to just keep bringing it all together where we can keep it. People should come in, right? That integration is great.
I love that. I think that's great. Well, thank you for all that you're doing and helping people get better. And taking the Western and Eastern and helping marrying those two together so the Eastern thing isn't so fringe anymore. I like this becoming mainstream.
Yeah,
and will you come back on here and talk more about herbs and Eastern medicine? Maybe? Will you twist your arm?
Twist, right. I'll have to ask my agent, Felicia. Felicia will have to let me know if I can.
Dr. Mary Devereaux, her contact information will be in the description below. Also, she's a concierge physician. Tell me more about that. What do you do for your concierge? How does that work?
It was similar to this conversation. It's like, what are their needs? Where do they feel that they are hurting? They've had pain for a long time. Because a lot of times I can help them with different foods or things they're doing, or how they're sitting on the couch, how they're leaning, how they're walking. That's causing these pains. So,
what if some Western physician says, "Hey, you need to have your gallbladder out"?
That's true. Oh, that's such a good one.
For me
it's
to
a good
call
one.
you for a second opinion.
Absolutely, because there's reasons why your gallbladder is upset. And when you get it removed, it's not going to solve that problem. So when you have pains, you've got to know your body. If you're having acid reflux, if you're having, if you're not able to breathe in deeply, let's fix those things, because then or if you're having low back pain, let's fix it before they do surgeries, because that doesn't solve what was causing it. Right. And sometimes too, like when people are menopausal and their hormone levels aren't where they need to be, that's going to break down your bones. Like estrogen works for your bones. And if you don't have them anymore producing more there's different foods and things you can do to strengthen your bones. And so that's all real important stuff, because you don't want to just start breaking down in your older years. You want to be doing this, like this, not like this. You want to. So.
I'll tell you what, when I go through menopause, you're going to be my first call.
I thought you went through it. You told me.
That's right. Oh. Dr. Mary Devereaux, thank you once again for talking with us.
That was fun.
Make sure you hit the like, subscribe, and share this with people that you care about. It's really good information. Thanks. We'll see you all next time.